I'm Mark Skelton, alongside Cameron Jones, Jackson Olson, and Macy Doty, and we're presenting the chin up. So first we have the demonstration video. We have Jackson at the gym, and he's going to show us how to do it. Perfect. All right, now we're going to go in depth to each phase. We're going to take the concentric and eccentric phases of each joint, and at the end we're going to come back and rewatch that video. So first up, we have the scapulothoracic joint. It is technically not really a true joint because there's none of the usual joint components. However, it does kind of glide like a gliding joint does. And the planes of motion, the axis of rotation of it are the frontal, which is anterior, posterior, sagittal, medial, lateral, and transverse, superior, inferior. In the prime movers of the scapulothoracic joint, we have the rhomboids and the middle fibers of the trapezius. Those perform adduction in the concentric phase. We have the lower fibers of the trapezius and the levator scapulae, and that performs depression in the concentric phase. We have the serratus anterior, and that performs elevation and abduction, and that is in the eccentric phase. And finally, we have the upper fibers of the trapezius, and that performs elevation in the eccentric phase. Thank you.
Okay, now moving on to the shoulder joint. This joint is known as the glenohumeral. The type of joint is ball and socket. The plane of motion is sagittal plane, and the axis of rotation for the joint is medial lateral. The prime mover / synergists are known as the latissimus dorsi, teres major, posterior deltoid, and pectoralis major. During the upward phase, a concentric contraction occurs, causing shoulder extension and adduction. During the downward phase, an eccentric contraction occurs, which causes abduction.
All right, so now we're going to look at the elbow joint. That's part of this movement. And so the elbow joint is a hinge joint, and it moves in the plane of motion of the sagittal plane, and the axis of rotation is medial lateral. And so all the prime movers are those that cross the elbow joint, or the humero-ulnar and humero-radial joints. And these muscles include the biceps brachii, both the long and short head, as well as the brachialis and brachioradialis. And all of the prime movers in the first phase of the movement or the motion are moving via concentric contraction. And in the second phase, or the downward phase of the chin up, they move eccentrically as you stay controlled through the whole motion on the way down.
Okay, I had the wrist joint. Technically, it's going to be two joints because there's actually two bones that articulate with the carpals in the wrist. It is going to be the radiocarpal and the ulnocarpal. They are both synovial joints, meaning that they have a fluid-filled cavity to decrease the friction while you're moving. The plane of movements are going to be the sagittal and the coronal in the wrist. And for sagittal, we're on the anterior-posterior axis. And for the coronal, we are on the medial lateral. The wrist is kind of a weird one because it's all going to be isometric on every single prime mover. Because you're not actually moving, you're just jumping up, holding onto the bar, staying there the whole time. You're not doing any other kind of movement until you let go. So our prime movers that are going to be helping us hold on to that bar are going to be the flexor carpi radialis, the flexor carpi ulnaris, the palmaris longus, the flexor digitorum superficialis, the flexor digitorum profundus, and the flexor pollicis longus. Again, all of these are moving isometrically. So you hold on, you let go, that's about it. After all that, if we want to go back, now that we've reviewed the joints, we can go back and look at this video again so we have a pretty good view of what we all just talked about. So if we want to go back here, we can hit play. Yeah, we are all good to go.